Welcome to another presentation by My Weight World. The title for this presentation is Medication for Weight Loss, Xenical. The goal of this presentation is to provide a brief overview of the weight loss drug Xenical. It is not to replace the advice or information you should get from either your pharmacist or doctor. Please consult with your doctor or pharmacist for additional detail. Do not rely on this presentation alone for information concerning this drug. Xenical was approved by the Food and Drug Administration, the FDA, in 1999. Ironically, in the fall of 1999, two popular weight loss drugs were recalled by the FDA when they were possibly linked to potentially fatal heart valve abnormalities. These were fenfluramine, the fen half of the popular fen-phen drug combination; Redux, dexfenfluramine. Technical issues. The generic name of Xenical is Orlistat. Xenical requires a prescription from your doctor. Unlike other weight loss drugs, Xenical works in the intestine, not the brain. How it works. Xenical has a unique mechanism of action. Xenical is a lipase, fat, inhibitor. It works in your digestive system to block about 1/3 of the fat in the food you eat from being digested. It does not change your appetite. Xenical works by reducing the body's ability to absorb dietary fat by about 1/3. It does this by blocking the enzyme lipase, which is responsible for breaking down dietary fat. When fat is not broken down, the body cannot absorb it, so fewer calories are taken in. This allows about 30% of the fat eaten to pass through the body undigested. In other words, it reduces calories by blocking your fat intake. Xenical should be used in conjunction with a reduced-calorie diet as well as an exercise program. Always consult your physician before beginning any diet or exercise program. Research studies. Let's look at the research done on Xenical. The effects of Xenical on weight loss, weight maintenance, and weight regain have been assessed in 7 1- to 2-year, multi-center, double-blind, placebo-controlled clinical trials. These studies included more than 4,100 patients. After 1 year of taking Xenical and eating a reduced-calorie diet, the average person lost 13.4 pounds. Those on a reduced-calorie diet alone lost an average of 5.8 pounds. On the average, patients lost 5% to 10% of their body weight over 1 year. Most patients began to lose some weight after about 2 weeks of taking Xenical. How long can you take Xenical for? A good question. The use of Xenical for more than 2 years has not been studied. Therefore, is this just then a short-term drug? More studies are needed to show that the drug is both safe and effective beyond 2 years. For now, it is up to your doctor on how long you can take this drug. Indications. This drug is for the purpose of treating obesity. Therefore, only people with BMI of 30 or 27 in the presence of other risk factors should be taking this drug. Ideally, taking Xenical in conjunction with a reduced-calorie diet and appropriate physical activity may be beneficial as opposed to just taking Xenical. Consult with your physician. Diet. Xenical should be used with a reduced-calorie diet with no more than 30% of calories from fat. It is not recommended for you to have a high-fat intake diet and use Xenical. Exclusions. Xenical is not indicated under the following circumstances: someone who does not meet the weight criteria, someone who is under the age of 16, certain medical conditions, consult with your doctor, including at least patients with chronic malabsorption syndrome or cholestasis, impaired bile flow, organic causes of obesity, such as hypothyroidism, should be excluded before prescribing Xenical. Patients who are taking a cyclosporin drug. Xenical and cyclosporin should not be taken within 2 hours of each other. And finally, patients who have had prior allergic reactions to Xenical or to any component of that product. In studies, the most common side effects were cramping, intestinal discomfort, passing gas, diarrhea, and leakage of oily stool. These side effects are generally mild and temporary, but may be worsened by eating foods that are high in fat. Again, the recommendations indicate that only 30% of your daily intake of calories should come from fat. Vitamins. Because Xenical reduces the absorption of some vitamins, patients should take a multivitamin at least 12 hours before or after taking Xenical. Can I take Xenical with other medications? This is a great question. Discuss with your doctor all medications you are currently taking, including over-the-counter medicines and herbal products you can get without a prescription, to determine if Xenical can be taken along with these. One medication in particular, cyclosporin, should be taken at least 2 hours apart from Xenical. If your cyclosporin levels are being measured, more frequent measurements may be necessary while you're taking Xenical. Alcohol. Small amounts of alcohol did not appear to affect the dosage of Xenical in one study. Consult with your doctor before drinking while taking Xenical. Pregnancy. The FDA put Xenical in the pregnancy category B. That means it isn't expected to harm an unborn baby, but don't take it without first talking to your doctor if you're pregnant or planning on pregnancy. Driving a car. Xenical should not interfere with your ability to drive your car. However, you should be on the alert for any signs of fatigue, sedation, or lack of alertness. Summary. Let's now summarize the drug Xenical. For most people, it can be a safe weight loss drug. On the average, patients lost 5% to 10% of their body weight over 1 year. Safety and effectiveness beyond 2 years needs to be shown. There are some side effects like any other drug. It works by blocking some fat absorption, therefore reduces calorie intake. A daily multivitamin is necessary. And finally, consult with your doctor or pharmacist about any issues with Xenical or any other drug. This has been another presentation by My Weight World.